how's it going, my friend? Hope you're having a great day so far. Welcome back to my channel. Today we are talking about lactose intolerance. I wish you a good viewing and I remind you that I am at your disposal below in the comments for doubts, questions and constructive criticism.
Lactose intolerance is a condition in which you have digestive symptoms such as bloating, diarrhea, and gas after you consume foods or drinks that contain lactose. Lactose is a sugar that is naturally found in milk and milk products, like cheese or ice cream. In lactose intolerance, digestive symptoms are caused by lactose malabsorption, a condition in which your small intestine cannot digest or break down all the lactose you eat or drink. Not everyone with lactose malabsorption has digestive symptoms after they consume lactose, but only people who have symptoms are lactose intolerant. Most people with lactose intolerance can consume some amount of lactose without having symptoms. Different people can tolerate different amounts of lactose before having symptoms. Lactose intolerance is different from a milk allergy, which is an immune system disorder. While most infants can digest lactose, many people begin to develop lactose malabsorption, a reduced ability to digest lactose, after infancy. Experts estimate that about 68% of the world's population has lactose malabsorption. Lactose intolerance is caused by lactose malabsorption. If you have lactose malabsorption, your small intestine makes low levels of lactase, the enzyme that breaks down lactose, and can't digest all the lactose you eat or drink. Undigested lactose passes into the colon. Bacteria in the colon break down lactose, drawing liquid and producing gas. In some people, this extra fluid and gas causes lactose intolerance symptoms. In some cases, your genes are the reason for lactose intolerance. Genes play a role in the following conditions, and these conditions can lead to low levels of lactase in your small intestine and lactose malabsorption. Lactase non-persistence. In people with lactase non-persistence, the small intestine makes less lactase after infancy. Lactase levels get lower with age. Symptoms of lactose intolerance may not begin until later childhood, the teen years, or early adulthood. Lactase non-persistence, also called primary lactase deficiency, is the most common cause of low lactase levels. Congenital lactase deficiency. In this rare condition, the small intestine makes little or no lactase, starting at birth. Not all causes of lactose intolerance are genetic. The following can also lead to lactose intolerance: injury to the small intestine. Infections, diseases, or other conditions that injure your small intestine, like Crohn's disease or celiac disease, may cause it to make less lactase. Treatments, such as medicines, surgery, or radiation therapy, for other conditions may also injure your small intestine. Lactose intolerance caused by injury to the small intestine is called secondary lactose intolerance. If the cause of the injury is treated, you may be able to tolerate lactose again. In premature babies, or babies born too soon, the small intestine may not make enough lactase for a short time after birth. The small intestine usually makes more lactase as the baby gets older. What is the difference between lactose intolerance and milk allergies? Lactose intolerance and milk allergies are different conditions with different causes. Lactose intolerance is caused by problems digesting lactose, the natural sugar in milk. In contrast, milk allergies are caused by your immune system's response to one or more proteins in milk and milk products. A milk allergy most often appears in the first year of life, while lactose intolerance typically appears later. Lactose intolerance can cause uncomfortable symptoms, while a serious allergic reaction to milk can be life-threatening. Lactose malabsorption is more common in some parts of the world than in others. In Africa and Asia, most people have lactose malabsorption. In some regions, such as Northern Europe, many people carry a gene that allows them to digest lactose after infancy, and lactose malabsorption is less common. In the United States, about 36% of people have lactose malabsorption. While lactose malabsorption causes lactose intolerance, not all people with lactose malabsorption have lactose intolerance. You are more likely to have lactose intolerance if you are from, or your family is from, a part of the world where lactose malabsorption is more common. If you have lactose intolerance, You may have symptoms within a few hours after you have milk or milk products or other foods that contain lactose. Your symptoms may include bloating and diarrhea, gas, nausea, pain in your abdomen, stomach growling or rumbling sounds, vomiting. Your symptoms may be mild or severe, depending on how much lactose you have drunk. Lactose intolerance may affect your health if it keeps you from getting enough nutrients, such as calcium and vitamin D. Milk and milk products which contain lactose are some of the main sources of calcium, vitamin D, and other nutrients. You need calcium throughout your life to grow and have healthy bones. If you don't get enough calcium, your bones may become weak and more likely to break. This condition is called osteoporosis. If you have lactose intolerance, you can change your diet to make sure you get enough calcium while also managing your symptoms. To diagnose lactose intolerance, your doctor will ask about your symptoms, family and medical history, and eating habits. Your doctor may perform a physical exam and tests to help diagnose lactose intolerance or to check for other health problems. Other conditions, such as irritable bowel syndrome, celiac disease, inflammatory bowel disease, or small bowel bacterial overgrowth, can cause symptoms similar to those of lactose intolerance. Your doctor may ask you to stop eating and drinking milk and milk products for a period of time to see if your symptoms go away. If your symptoms don't go away, your doctor may order additional tests, like hydrogen breath test. Doctors use this test to diagnose lactose malabsorption and lactose intolerance. For this test, you will drink a liquid that contains a known amount of lactose. Every 30 minutes over a few hours, you will breathe into a balloon-type container that measures the amount of hydrogen in your breath. During this time, a healthcare professional will ask about your symptoms. If both your breath hydrogen levels rise and your symptoms get worse during the test, your doctor may diagnose lactose intolerance. A genetic test is also available, which can indicate whether or not the subject is predisposed to developing a reduction in the activity of the lactase enzyme. Predisposed means that there is the possibility of developing intolerance, but it is not a certainty. In most cases, you can manage the symptoms of lactose intolerance by changing your diet to limit or avoid foods and drinks that contain lactose, such as milk and milk products. Some people may only need to limit the amount of lactose they eat or drink, while others may need to avoid lactose altogether. Using lactase supplements can help some people manage their symptoms. Lactase supplements are tablets or drops that contain lactase, the enzyme that breaks down lactose. You can take lactase tablets before you eat or drink milk products. You can also add lactase drops to milk before you drink it. The lactase breaks down the lactose in foods and drinks, lowering your chances of having lactose intolerant symptoms. Check with your doctor before using lactase products. Some people, such as young children and pregnant and breastfeeding women, may not be able to use them. It's important to note that you may not need to completely avoid foods and beverages that contain lactose, such as milk or milk products. Also, if you avoid all milk and milk products, you may get less calcium and vitamin D than you need. People with lactose intolerance can actually tolerate varying amounts of lactose. According to EFSA researchers, a single threshold of lactose for all lactose-intolerant subjects cannot be determined, owing to the great variation in individual tolerances. Symptoms of lactose intolerance have been described after intake of less than 6 g of lactose in some subjects. The vast majority of subjects with lactose maldigestion will tolerate up to 12 g of lactose as a single dose with no or minor symptoms. Higher doses may be tolerated if distributed throughout the day. 12 g of lactose is contained in approximately 1 cup of milk. You also may be able to tolerate milk and milk products if you drink small amounts of milk at a time and have it with meals. Add milk and milk products to your diet a little at a time and see how you feel. Try eating yogurt and hard cheeses like cheddar or Swiss, which are lower in lactose than other milk products. Use lactase products to help digest the lactose in milk and milk products. Using lactose-free and lactose-reduced milk and milk products may help you lower the amount of lactose in your diet. These products are available in many grocery stores and are just as healthy for you as regular milk and milk products. What foods and drinks contain lactose? Lactose is in all milk and milk products and may be found in other foods and drinks, sometimes in an unexpected way. Milk and milk products may be added to boxed, canned, frozen, packaged, and prepared foods. If you have symptoms after consuming a small amount of lactose, you should be aware of the many products that may contain lactose, such as bread and other baked goods, such as pancakes, biscuits, cookies, and cakes. Processed foods, including breakfast cereals, instant potatoes, soups, margarine, salad dressings, and flavored chips and other snack foods. Processed meats, such as bacon, sausage, hot dogs, and lunch meats. Milk-based meal replacement liquids and powders, smoothies, and protein powders and bars. Non-dairy liquid and powdered coffee creamers, and non-dairy whipped toppings. You can check the ingredient list on packaged foods to see if the product contains lactose. The following words mean that the product contains lactose: milk, lactose, whey, curds, milk byproducts, dry milk solids, non-fat dry milk powder. A small amount of lactose may be found in some prescription and over-the-counter medicines. Talk with your doctor about the amount of lactose in medicines you take, especially if you typically cannot tolerate even small amounts of lactose. If you are lactose intolerant, make sure you get enough calcium and vitamin D each day. Milk and milk products are the most common sources of calcium, but many foods that do not contain lactose are also sources of calcium. Examples include fish with soft bones, such as canned salmon or sardines, broccoli and leafy green vegetables, oranges, almonds, Brazil nuts, and dried beans, tofu, products with labels that show they have added calcium, such as some cereals, fruit juices, and soy milk. Vitamin D helps your body absorb and use calcium. Be sure to eat foods that contain vitamin D, such as eggs and certain kinds of fish, such as salmon. Some ready-to-eat cereals and orange juice have added vitamin D. Also, and most of all, being outside in the sunlight helps your body make vitamin D.
Thank you with all my heart for your attention and trust. In my small way, I remain available below in the comments for doubts, questions, and constructive criticism. But please always remember that a stranger on the internet does not, it can, and above all, must never replace your physician. Thanks again. Bye.